On the 26th, we have added 1,606 confirmed new cases, and 1,606 are local cases. Among them, 340 have been found in central quarantine. 13 are screened out among the risky population. 1,256 among them used to be asymptomatic carriers. In addition, 11,956 are asymptomatic carriers. 158 of them were found among the risky population. By the end of the 26th of April, in the designated hospitals, 244 were heavy cases. 27 were the mild cases. As to the new death cases, they were 48. The average age of the people were elderly people, and they usually suffer from some underlying diseases, for example, cerebral diseases and the cardiovascular diseases, hypertension, and dysfunction of the heart, and some tumors in the late stage. And they haven't been vaccinated. So the causes of death are the underlying diseases. Starting from March the 1st till yesterday, the total cumulative confirmed cases were 535,600. By 9 this morning, and about 512,350 were the close contacts. 2,639 were discharged from the hospital yesterday. 30,534 were discharged to their communities who used to be the asymptomatic carriers, so the communities must receive them properly. Ever since we kicked off the campaign, we have generated some market results, but still we are at a critical moment. To further eradicate the cases and have a dynamic zero-case scenario, we must have categorized measures and take collective efforts. And to that end, we will minimize the gathering activities. We will continue to have the static management of this whole region, the all-mass nucleic acid testing, comprehensive disinfection, to find any loophole. In the next step, today, we will hold a combination of screening, including antigen tests and nucleic acid tests. And based on the results of the test, we will dynamically change the definition of the three regions called the contained areas, controlled areas, and prevention areas. To have friendly nucleic acid tests, yesterday we have published 534 regular nucleic acid testing stations, and they will be open to the public for usage later on. Thank you, Director Zhao Dandan. Now let's open the floor to questions and answers. Please identify yourself before raising the question. From line number 4.
你好，主持人，我是光明日报的记者，我有个问题想提问。
From Guangming Daily.
上海正在开展核酸筛查行动。
Shanghai is staging the masses nucleic acid test. So could you please share with the information you've got? Thank you for the question. We have got the temporary results of prevention and control, but now The situation is still quite
防控
complex.
工作呢，也是刚才说了，
As I
处于
said,
较劲爬坡的一个关
We
键
are
时刻。
trying to conquer
我们呢也
the
在尽力
difficulties,
的
just like
推进
climbing
全社
uphill.
会面清零
And
攻坚行动。
since we are
那么
dedicated
核酸筛
to
查
have dynamic
行动呢，
zero
就是其
case
中一个
in
非
the
常
society,
重要的环节。
nucleic acid test is going to be
那
a
么从
very
目前的采样检测
important
能力来看，
means. Based on the
近
current
5天，也
sampling
就是过去的
results,
5
in
天，
the
我
past
们每
5
天
days,
配置了
every
近
day,
2万多个采样
we
点，
have opened
投入了
20,000
10万
stations for the test,
11万
and
人次的采样队伍，
100,000 professionals were
匹配了
dispatched in the
500万
stations.
管的最大的
5
检测能力。
million tubes were
从采样检测的
sent
组织
for
管
the
理看，
test. And as
社
to
区
the
的组织
organization
越
of
来越
the
有趣
screening,
了，
the
越来越
neighborhood
有趣。
communities are
采送
working
检报
in an
和
orderly
各环节的
fashion.
衔接也越
Collection,
来越
sample
熟悉。
taking, and transportation
从
and
采样的结果来
reporting
看
have
呢，
been
累
going
计
on
筛查了
smoothly based on the results.
5100余万人次，阳性
About
检出率
51 million were
应该是
tested,
逐步下降。
and the ratio of
接下
positive
来，我们
cases
也将不断
has
优
been
化方案，
declining.
进一步
In
提
the
高
future,
筛
we
查
will
的质
continue
量
to
和效
optimize
率。
our screening
那么
plan
在
to
此呢，
improve
感
its
谢市民
efficiency
朋友们
and
对筛查
quality.
工
So
作的
here, I
全
would
力
love
支
to
持和
thank
配合。
all
谢
the
谢。
civilians for their
谢谢，
support.
继续提问。
Next question.
好，我们请12号线
From
路的
line
记者。
number 12.
12号线路。
Line number 12.
好，感谢主持人。金明晚报的记者有一个问题想提问。那么风控已经持续了将近1个月，
From Jing
对于特
Evening
殊困难
News,
群体，
the
比如
containment
高
has
龄、
been going
独
on for
居、
1
患
month.
病
For
等
the
面临生
vulnerable
活困
groups,
难的
for
老年
example,
人
the
和残疾
elderly
人，
people
有没有
suffering
相
from
关的保障
diseases,
措
the
施？那
disabled,
么在求
do
医
you have
问
any
量方面，
protective
他们应该如
measures?
何解决？
If
谢
they are
谢。
in need of medical services, how are they gonna acquire them?
好，谢谢您的提问。
Thank you for the questions.
疫情防控期间啊，老年
During the
人，
containment
尤其是
days,
高龄的、
the
独居的、
elderly
患病的老
people
年人，
suffering
和我们
from
的残障人士啊，
diseases and
会
are
面临
left
比普
alone
通人
or the
更多的困难。
disabled will face
比如
ever
说
more
生活物
difficulties
资
than the
缺少，
ordinary people.
子
For
女
example,
无法陪护，
they lack daily
再比如
necessities
说
and
求医
their
问药更不便。
children cannot escort
那么
them,
应该说，一直以
and
来
it's
相
hard
关
for
部
them
门
to access
和
the
各区、
medical help.
各街
So
镇、
the
各
different
居村
neighborhoods
一
and
直
the
一直在
communities
采
and
取措
villages
施，也
have
在尽力
been
的
stepping
解
up
决。
to solve those problems.
但是呢，我们
However,
也深知
We are deeply
工作中
aware
还有很多不到位的
that
地方，
there are still
有一些特殊
some
困难群体
loopholes
的
for
诉
us
求
to，filling.
我们还
Some
没有及时
vulnerable
的
groups'
发现
pursuits，haven't been
我们的回应呢
identified in
也
a
还不够
timely
及时。
manner, and we were not
为此
responding
呢，近
instantly
期啊，
to
民
their
政部门、
demands.
卫生
To
健康
that
部门、
end, the
商务
Health
部门、
Commission,
参联部
the
门，
commercial
我们一起研
bureaus,
究啊，
and
形
the
成了
Federation for the
工作指引、
Disabled have
工
been
作指
working
引。
together to
目的呢，也是
promulgate a
为了进一
guideline
步的
to
加强
better
啊，
assist
疫情期间
those
这部分
vulnerable
特殊困
groups
难群体的关爱和保
during
障
the。containment
那么
period.
对于这个指引呢，
We
我们
will
想着重
reinforce
在
our caring
以
for
下几
them,
个方面
and we
进一
would
步
love
的予以
to
完
work on
善
the。following fronts.
一呢
First
是
of all,
完善主动发现的机制。
We will try
主
to
动发现的机
identify
制。
their needs
我们呢，首
actively.
先要求还是要充分的依托
Ask
我们
for
原有的一些
the
工作机制，
reliance on the
比如说我们民政系
established
统的
working
社区
mechanisms.
养老顾问、
For example,
老伙伴
advisors,
计划机制、
the
各区的
peer
慰老服务
groups,
监通，还有
the
残联的工作系统，全面的
federations,
拨清
and the
这部分群体
neighborhood,
的需
so
求。
as to have a clear
那么这
idea
个群体
about
的
the
话呢，
needs
我
of
们也
those
考虑
vulnerable
既
groups.
要包括本市高龄的独居老年人，
We must
我们的
cover
养老
our
服务补贴
services
对象
over the elderly
还要包
people
括
living
疫情
alone
期间因家人啊被隔离
and
收治，无人照
the
料，
elderly people left alone
因
because
子
their
女亲
family
属居
members
住
have
地
been
封控，
quarantined.
导致实际上发生了临时独居的
So
特
the
殊困难
second
的
type
老年人，
of the elderly people
还包
are
括了
also
我们
living
一些
alone right
特
now.
殊困难的残障
We
人
also
士，
hope to cover
他们的
the
一个
disabled.
这个实际需求啊，我们都要
We must
主动
fully
的、全面的进行
account
来弄。
for their actual
同时
needs
呢，我们也
with active
特别提出
identification.
必须
We
要
also
通过
propose
建立
that
实时的发现机
we
制，
must have a
动态地去
timely
掌握
discovery
我们
mechanism
特殊
so
困难
that we
群体
can
的
have
动态需
dynamic
求。
idea
为
of
此
the needs
我们
of the
公布了
vulnerable
各区
groups.
养老服务热
For
线电
that
话，
matter, we
安
have
排了专
opened
人
a
24小
hotline,
时
and we also have
随时的
dedicated
值守
teams
和接听。
to answer the
此外，我们
calls
继续推动在
24/7.
居民区层
And
面
also in the
建立
neighborhood
一支
committee,
专门为
we
居民
have
区特殊
established
困难群体
a
服务的
special
志愿者小分队，
volunteering team to serve the vulnerable
及
groups.
时收集本小区
The
内特殊困难
volunteers
群体的
will collect information about the needs of the vulnerable groups in that neighborhood and come to their
我们也
rescue
希望
instantly.
各区
We
民
do
政
hope
局
that the Civil Affairs Bureau,
通过
the
上述的
Federation for the
发现机
Disabled
制
people, might
能够
make
建立
better
一个疫情
usage
期
of
间的
those
特殊
mechanisms
困难
so
群
that
体需求
during
的
the
名单库
pandemic
名单库，
time,
及时
they
的
could
发
be the
现，同
database
时呢
for
及时
the
的回
vulnerable
应，
groups and have
第二
timely
个呢是
discovery and response to
完
the
善资源
disabled
调配的
people.
机制，
And secondly, we must improve our
努
mechanism
力的落
of
实特殊
resource
困难群体的
distribution
生活保障。
so as to
我们
guarantee
要
their
求以
basic
街镇
lives.
为枢纽，
The neighborhoods must be the basic
成立工作专
unit
班，
to
建立
establish a
资源
working
统筹
group
调配平台。
for better resource
那么在
distribution.
这个平台上面，街镇有困
On
难的
that platform,
可以提
the
起到
vulnerable
区域层
people
面来统筹。
could come
在摸
to
清了特
the
殊困难
help
群体的
of
需
the
求后，
regional level. And
有个街镇
after getting an
及时
idea
响应，
about
落
the
实解
needs
决
of the
相关的问题。
vulnerable,
比如说，
the village or the
特殊困难群
neighborhood
体
level will try to
为特殊困
implement
难
the
群体
measures.
啊
For
提供
example,
一
for
般
the
的生
vulnerable
活物资的
groups,
配送，
the distribution of the
比如说，
daily
调配
necessities will be
专
handled
供
by
外出
that
就医的
working group,
巡游的出租车，
and they will help to
比如
hail
说协调街镇层面
taxis
的助餐
or
和生活
cabs
照料服务资
for
源。
those vulnerable
还
people,
比如
and they
说，
will try to deliver
紧急
the
的处置
takeaway
突发
food
情
for
况等
them.
等。
And they can also come to their help
同
when
时，
they are in
在区域层面，
emergencies. At
我
regional
们要求
level,
建立
we ask
特
for
殊
the
困难群体
establishment
生活
of
保
the
障
vulnerable
协调
groups
机制，
coordination
专门解
mechanism.
决街镇无法解决的
The
保障需求，
mechanism will try to solve the unresolved problems
特别是对于一些个性化
submitted
的
to them from the
紧缺物资
neighborhood
的需
level,
求，
especially the
像这个
urgent
老尿管啊
need for
成人尿不湿
the
等啊，
rare
由各
resources,
区
for
啊
example,
来统筹解决。
diapers.
那么对于区域层面也无法解决的，
If the problems
我们明确了
remain
由百联集团、
unresolved at
上
regional
海医药
level,
等国有大型企
the
业
state-owned
进行脱离解决。
enterprises, for example,
第三个是
the
完善配送到
Shanghai
家的机制。
Pharma will try to solve the problems.
特殊困难群体
Third,
的基本生活物
for
资
the
呢，
vulnerable
我
groups,
们要
their
求
daily
各街镇
necessities
统赔、
must be
统
distributed
筹、负责
in a
配送到
coordinated
小区，
fashion by the neighborhood.
然后呢，由社区的居委会
Then the
或
neighborhood
志愿者小分
committee
队
or the
负责
volunteers
配送上门，
will
务
deliver
必呢
them
确保
in
最后
person
100米
to their
都畅通。
doorsteps so that the last 100-meter issue
此外，
can be solved.
依托志愿者小分队作
In
用，
addition, by
帮助
relying
特殊
on
困
the
难群体
volunteers,
进行
the
代
vulnerable
配药。
groups could
在
ask
这个方
for the
面，
help of the
我们也了
volunteers
解
to
到
have a prescription
有许多区啊，
of the
都已
drugs.
经有了
As
实
we
质性
have
的行动。
learned, some
有些区呢也已经
regions
形成了
have already
较为
started
完整
this
的一
work.
个工作体系。
They even established their own system.
我就介绍这些。
That's all I can share. Thank you.
好，谢谢。继续提问。
Next question.
我们请8号线路的记者。
From line number 8.
谢谢主持人。凤凰卫视记者有一个问题想问。
From the
最近有
Phoenix
一些市
TV.
民反映有一些防疫物
Recently,
资
we've
出现
heard
质
from
量
the
问题，比如
civilians
说
that
口
some
罩还有棉签
medics
等。
or
那么请你是否可以
materials
回应一下？
and
那么另外
supplies might
呢，
have
如何来
quality
加强
issue.
对于医疗器械，特别是这种一次性用品的监管？
For example,
谢
the
谢。
swabs. So how can we better monitor those disposable
谢谢您的
items
提问。
quality?
医用防护用品的
Thank you
安
for the
全
question.
事关
The
百姓
safety
健
of
康。
these supplies,
本市的药
especially
监
the
部门
medical
呢，近
supplies,
期呢
matter
对
to the
尤
health of the
其使用
civilians.
量剧增的
Recently,
这种
for
新冠试剂
this
医用口罩、
increasing number
防
of
护服，包
medical
括一次
facial
性的
masks,
采样器，
protective
也就是
clothes,
刚才我们
and
这个提到的棉
ventilators
签啦、
and
食品的这些情
swabs,
况，我们实施高频次监
we
管。
have
主要
high
呢采取
frequency
以
of
下措施。
monitoring.
第一个呢，就
First
是
of
加
all,
强全链条的监管。我们
we
对本市的
monitor
生
the
产
whole
企
chain.
实施全覆盖的检查和抽
We
检。
cover
近期呢，我
all
们
the
对本市的
manufacturers in the
15家
city.
生产企
There
业
are 15
已经开展
producers
了
in the
3例
city
检
right
查。
now. We already
同时
have
呢，
our
我们
checks
组
on
织
them.
区的
Meanwhile,
市
we
场监管部门一起
organize the
对
district
流
level
通使用
monitoring
单位也加强监管。
supervisors
累计呢，
to
共出动人
supervise
数呢
the
3450
circulation
人，
agencies.
排查相关企业呢
3,000
1841户次。
times of such checks have been carried out. We also work together with the Yangtze River Delta area to have a synergy effect. Secondly, we urge the enterprises to hold themselves accountable. And for the relevant enterprises, we've sent our letter of notice to them asking the enterprises to sign a commitment to quality for their products. Otherwise, the supervisors of their enterprises responsible for quality will have to sit on the table to talk with us. And we put high premium on the R&D of the new drugs so that they could go to the market earlier. Certain enterprises have been working around the clock so as to register and develop the medical equipment relevant to the prevention of COVID-19. And we have successfully developed the autonomous screening equipment and the reagents for nucleic acid test. And together we will work with the government agencies to increase the producers' capacity in order to add new blood to our containment work. And fourthly, we will crack down upon the illegal behaviors. We pay high attention to the complaints of the civilians. With our regular monitoring and supervision, we will crack down upon all the discovered problems. Since April this year, we have filed 5 cases about the quality of the medical supplies. 4 of them have been transferred to the Public Security Bureau. So that was quite an intensive situation as to the complaints of the civilians and our information monitoring. As long as it comes to the issue of the quality and safety of the medical resources, we would certainly file the cases. Since you mentioned about the swabs, reagents, the facial masks, for those issues we will organize our supervisors to establish their working teams. And we will also ask certain provinces to check the situation. And we will also refer to certain documents. We here would love to call upon the civilians and the committees to pay attention to the quality and safety of those medical supplies. If you do discover the quality problems, we ask you to call 12315 to complain to us, and we will immediately send out our professionals for the review. If it indeed is a problem, we will crack down upon them and handle the cases in the hands of certain authorities. The last question, please. From line number 14. From Shanghai TV. Now, when the infected people are transported to the temporary hospitals, will they receive immediate medical resources? Some people might be in need of some regular drugs. Will they have any shortage of such regular drugs, especially the prescribed drugs in the temporary hospitals? Thank you for the questions. Please be reassured. The makeshift hospitals certainly can provide the medications. The targets of the makeshift hospitals are mainly the mild cases and the asymptomatic carriers. For these 2 groups of people, according to the version 9 of treatment and diagnostics plan, we offer health monitoring and follow-up visits to offer the customized treatment. And we also will administer some TCMs so that the patients can be discharged as early as possible. And in the makeshift hospitals, we have equipped ourselves with some regular medications, for example, treating the hypertensions. And also, based on the conditions of the patients, we can also offer some prescribed medications for the patients. For example, if we have discovered underlying diseases of the patients, asking for the immediate treatment or the instant fit of some diseases, we will try to transfer them to the designated hospitals for better treatment. And also, in the emergency rooms of the makeshift hospitals, we have the medical resources to transport them, for example, the ambulances. But of course, we have limitations in the makeshift hospitals. For some patients, if they are in need of some individualized medications, we may not be able to meet the requirements. If that's the case, we will try to readjust our list of medications so as to equip ourselves with as many medications as possible and meeting the basic needs of medications of our patients. Thank you. This is the end of today's Q&A. And if our reporters have more questions, please come to the Shanghai Municipal People's Government and the Health Commission, and we will publish the latest data in the future. Thank you.